Incontinence per se is where you cannot control your waterworks. You're leaking. Female incontinence, there's basically two types of incontinence, or multiple types of incontinence, of which two is the most important. One is stress incontinence, where you leak when you cough and sneeze, or anything that increases your abdominal pressure. Then you get the urge incontinence, where there is an uncontrollable need to go to the toilet and you cannot control and you leak. Then you can get a combination of those two together, which will contribute to a mixed incontinence. Very much so, very much so. Especially stress incontinence is very much related to how good your pelvic floor health is. Diligent pelvic floor exercises, or Kegel's exercises, is one way to prevent stress incontinence. Urge incontinence, again, quite a lot of the time we find that this is secondary to a lot of irritable fluid intake, especially caffeine. Then you can get irritable urinary habits with citrus juices, blackcurrant juice, tomato juice, alcohol. Anything in excess is not that great. So lifestyle modifications is very important. Sometimes the bladder de novo is unstable or unstable in women, and these will have to be treated with medication in conjunction with lifestyle modification and exercises. One is multiple deliveries, or childbirth is one of the commonest. The second one that we find is the change in life that happens with menopause. That produces a lot of changes in the pelvic health of women that will contribute to urinary symptoms as well. Two times when you need to be more vigilant with your pelvic floor. Women very seldom come forward unless their problems are quite significant. So it's important that you globally look at how to manage the patient. There are numerous forms of management for stress incontinence. Kegel's exercises, pelvic floor exercises with weighted cones. Then you can progress to injectables. Previously, we used to do mesh tapes, which is, has been problematic, and it has been banned in most countries. And we don't do them here at all unless it is in a controlled environment. So most of the time, you're looking at doing a bulking agent, or you do autologous slings or things like that. But surgery in stress incontinence is most of the time is not that common, but it is more common and can be controlled with exercise. While on the other hand, urge incontinence is managed with anticholinergics, beta-2 agonists, which is mirabegron, or a combination of the two. If those don't work, then you can progress to tibial nerve stimulation or sacral neuromodulation. But in between, before you move to before you move to neuromodulation, you can think about Botox injections to the bladder as well. And quite a lot of the time it is, especially stress incontinence is curable, while urge incontinence or a mixed incontinence, you would be able to make the patient comfortable and their symptoms manageable, but they are never going to be 100% dry in most conditions. If you can bring the pad usage down to probably one a day, that would be probably termed as a cure.